Healthcare-associated infections, HAIs, are infections acquired during medical treatment, leading to complications, longer hospital stays, and higher costs. They spread through contaminated surfaces, instruments, or healthcare workers, causing bloodstream infections, pneumonia, UTIs, and surgical site infections. Immunocompromised patients and those undergoing invasive procedures face higher risks. Common types of healthcare-associated infections: catheter-associated UTIs, surgical site infections, and ventilator-associated pneumonia occur when bacteria enter the body through medical devices or wounds, leading to severe complications. Central line-associated infections increase sepsis risk, while Clostridium difficile infections cause severe diarrhea due to prolonged antibiotic use. Causes and risk factors: HAIs stem from poor infection control, including inadequate hand hygiene, improper sterilization, and antibiotic overuse. Patients with weak immune systems or those undergoing invasive procedures are at higher risk. Overcrowding, poor sanitation, and prolonged use of medical devices further increase infection chances. Impact of healthcare-associated infections. HAIs not only pose a serious health risk to patients, but also put a financial and operational burden on healthcare facilities. They lead to longer hospital stays, higher medical costs, and increased antibiotic resistance, making infections harder to treat. In severe cases, HAIs contribute to morbidity and mortality, particularly in critically ill patients. Preventing healthcare-associated infections. To prevent healthcare-associated infections, practice proper hand hygiene, sterilize medical equipment, and control antibiotic use. Limiting catheters, ventilators, and central lines reduces infection risks. Vaccination and isolating contagious patients help stop the spread. Visit Health's wellness and rewards programs, encourage better hygiene practices and infection prevention. Treatment and management of HAIs. Treatment depends on the type of infection and the microorganism causing it. Antibiotics, antifungal, or antiviral medications are commonly used, but drug-resistant infections require more advanced therapies. In severe cases, patients may need intensive care, surgery, or long-term medical support. Healthcare-associated infections affect millions worldwide. Strict hygiene, better hospital sanitation, and responsible use of medical devices can reduce risks. Awareness among healthcare workers and patients is key to prevention.